Hi, it's Dr. Kostelnik with Rooted Behavioral Education. I'm a clinical health psychologist and fellow vestibular patient. You can find me at rootedbehavioraleducation.com. So, in this video, I want to talk to you about why, when you feel stressed, it makes you feel dizzy. And this is a question I've been getting more often, so I wanted to address it in a video that will hopefully be helpful for people. So, first, to understand the answer to this question, we have to understand something called the autonomic nervous system, which is the part of our nervous system that's involuntary. So, we don't have to think about it to make it work. So the autonomic nervous system has two major branches, the sympathetic and the parasympathetic. And the sympathetic is fight or flight. So that really can get us revved up. Parasympathetic is rest, digest, regenerate. It's kind of calming. So if you think about vestibular symptoms, that causes the sympathetic nervous system to ramp up. So those of us with vestibular disorders have sympathetic systems typically that are in overdrive all the time. So if you think about anything, motion sickness, a vertigo attack, a migraine attack, you might have your heart racing or feel sweaty or nauseous. That's from the sympathetic nervous system. So hold that thought, keep that in your head. Anxiety also causes the sympathetic nervous system to ramp up. So let me explain something called negative plasticity. And for those of you wondering, why am I dizzy all the time when I wasn't before? It's called negative plasticity. So it's when neuroplasticity changes in your brain happen that kind of work against us, unfortunately. So it's when your brain becomes used to using the neural pathways for dizziness. So when you have a stress response, so say you're late to something, you forgot something, something happens at work, you go through a breakup, any sort of stressor, that stress response causes the sympathetic nervous system to activate. It's actually much more complicated than that. There's a cascade of neurotransmitters that happens as well. I'm not going to go into that here. But when you have a vestibular condition and anxiety that plays into that same system, it defaults towards the negative plasticity. So if your brain is used to feeling dizzy, because those pathways are the ones that are used a lot now, used more than the balance pathways, when you feel stress, it activates that sympathetic nervous system and engages those same pathways. So I hope that makes sense. The good news is there are things you can do to help promote positive plasticity. So kind of helping to restore balance, which can involve ramping up the parasympathetic system. So to bring them back more into balance, things like diaphragmatic breathing, progressive muscle relaxation, biofeedback, mindfulness meditation. So I hope this kind of explains a little bit about why when you feel stressed, it makes you a bit more dizzy. If you have any questions, find me at rootedbehavioraleducation.com, Instagram, Facebook. You can email me at info@rootedbehavioraleducation.com, and I'll see you next time.